My name is Dr. Erika Montgomery. I am a clinical psychologist. I have been practicing mental health for over 23 years. I also do I'm also a medical consultant with the Social Security Administration for disability in mental health. And I'm also a host of the weekly podcast, Master Your Mind with Dr. Erika, on the Law of Attraction Radio Network. And this is my website here. It's healthyminds.expert. And I just want to say that my journey with Wakana and CBD started more than 2 years ago. And I have been using CBD daily for my mental health, for my stress release, so that I can feel calm and focused and provide the support that my patients need from me. And, these last 2 years since this pandemic started has been very, very stressful for us all. And my practice has more than doubled. And so I really, really value, the benefit that I've received for CBD. And so I just want to share a little bit of my mental health and wellness tips with you all tonight. Okay. And so let's see. So I'm just going to give you some quick facts on mental health, since this is really what we've been dealing with this year. 1 out of Americans struggle with mental conditions each year. And did you know that 8 million Americans who have serious mental illness don't receive adequate treatment? About 20% of the population suffers from some form of anxiety. And pharmacists, physicians, psychiatrists, and psychologists, well, we're not prescribing, but we are definitely recommending CBD to help with the rising anxiety, with the rising stress, chronic stress from the last 2 years, with the rising cases of anxiety and depression. So who is mental health for? I always say to the people that I work with, or anyone, mental health is really human health, because every human being needs to have a healthy mind, because a healthy mind leads to a healthy body, leads to healthy relationships, and a healthy ability to function. And so I always say mental health is really for everyday people, who are going through life's changes, whether that's lifespan changes, childhood, adolescence, adults, aging, loss, transitions, and trauma. Mental health is for everyone. We all need the support for our mental health, especially during the last 2 years. Like I said, it has been increasing the cases of anxiety, stress, and just chronic symptoms. Mental health is for people that need healthy outlets to share their thoughts and feelings and to grow and change through their situations. Mental health is for individuals with courage and motivation to change, because it takes courage to reach out and ask for help. It takes courage to know that you can't do it alone, that you need help. And that's what, to me, when someone reaches out to me, that's what makes me feel proud of them, that they took the first step to say, you know what, I can't do this alone. I need help, And so, again, mental health is for problem solving. It's for learning coping skills, learning healthy ways to manage your emotions or understand where your emotions are coming from, and really just support and caring for yourself, which is what we all need to be doing right now in this time of change and transition and uncertainty, you know. Again, mental health is really developing a confidential relationship that is non-judgmental, and it improves your relationship not only with yourself but with others. And so, my motto when I'm doing therapy is always like, I'm human, you're human, you have your flaws and your mistakes, and I have mine. So who am I to judge? And that's what I say about all human beings. We are imperfect. And so we know we're going to make mistakes. We know we're going to go through challenges and changes. And so it's okay to reach out because we all need that support. We need that third party perspective, that outside perspective. And so a lot of people ask, well, how do I get access to to mental health services, or insurances might refer to it as behavioral health services. And so the first place that I will recommend or direct someone to is really their insurance. If you are working and you have insurance, or you're not working and you're covered with insurance, reach out to your insurance company. Ask for an employee assistance program, because the employee assistance program offers free sessions. It could be three free sessions, or it could be more. And in that way, you can get a sense of, is this a good fit for you? Is this helpful for you and supportive for you? Also, a lot of therapists or professionals accept private pay. And if you're going to pay out of pocket, a lot of times they'll offer you sliding scale fees. And so, that could be an option as well. If it's a school service, go to the social worker, the school counselor, talk to the case manager. Schools provide that assistance, especially in the public schools. There's also a toll-free crisis line. If you just want to reach out, if you feel like you're on the brink and you just need just something to hold on to, reach out to the support line. It's 1-800-784-2433. So that's who mental health is for. It's for all of us. If you're human, it's for you too. And so I know that we all have been, again, under stress, chronic stress. Chronic means it's more than a year, more than 12 months. And we've all been dealing with this now for 2 years. So we all are dealing with chronic stress. And so I know that approximately 90 to 95% of physical ailments are stress induced, whether it's hypertension, heart attacks, ulcers, chronic pain, anxiety, depression, insomnia, right? If you cannot have a healthy body unless you have a healthy mind. Because if you all were there at our conference this weekend, that was phenomenal. You learned a lot about stress and the effects that it has on our physical body. And so prolonged stress suppresses our immune system. It weakens our body's natural ability to heal itself. And CBD is an effective way to reduce the stress. I saw a hand going up, but what I will do is I will, let me see, hold on. I believe I can connect into audio. Okay. I believe I can address any questions that you have. Okay, my slides are not changing. Gotcha. Okay. Do you see this slide? Not seeing slides. Okay, so y'all aren't seeing my slides. Okay. Okay, let's see. Can you see them now or no? Not seeing slide. Yes, you can see them now? Okay. No, Monica can't. We see them. Okay, yes, you see them. Okay, okay. So you can see them. Okay, great. Just the one. Can you see this one with stress? Okay, let's see. Hold on. Let me go back. Can you see this one now? Can now see it. Gotcha. Okay, I apologize for that. Thanks, guys, for letting me know. Okay, great. Great job. Do I need to back up, or is everyone good? I'm going to put this chat right here. Okay, answer all questions at the end. Gotcha. We're going to do that then. So we're going to keep going. Okay, so really stress and CBD, again, 90 to 95% of physical ailments are chronic stress induced. And again, that prolonged stress suppresses our immune system, weakening our body's natural ability to heal itself. But we have CBD, and CBD is an effective way to reduce that stress. CBD receptors are found in the central nervous system and throughout the body, including the immune system, sending signals to the body to calm the stress response, lowering inflammation and reducing pain. And so, one of the go tos that I suggest for my patients that I work with is CBD. Anyone comes to me with stress, anxiety, insomnia, depression, my first recommendation is CBD because I know the benefit that it has. Okay, let me see if I can position this upward. Okay, and so really there are, more and more people are becoming aware of the value of CBD. They're talking more about CBD in the news, talking more about CBD in, research. CBD you can get at local stores, and I'll talk a little bit about more about the quality and purity of the CBD that we offer here at Wakana. But I just wanted to bring to mind some athletes and professionals and celebrities that endorse the use of CBD so that CBD is becoming more mainstream. So again, the professional athletes take CBD for pain, for muscle aches, for anxiety, right? Um, any type of pain that's reduced. Again, we've got Morgan Freeman, we've got Paul Pierce, we've got just different athletes who endorse it. And so, two of the most common disorders that I work to treat are depression and anxiety. Some of the symptoms for depression include depressed mood, loss of interest, significant weight gain or loss, insomnia or hypersomnia, that means you can't sleep or you're sleeping excessively, diminished concentration, fatigue, feeling worthless, guilt, agitation, low energy, markedly diminished interest, thoughts of death in those severe cases. And so some of these symptoms sound familiar, and these symptoms have to be present for 2 weeks, and they have to include a change from your prior functioning. So that's the key. It's not just you have the symptoms, but it has to impact you in a way that it changes your ability to function, and it changes how you're used to managing yourself or managing your daily life. And so we know that CBD oil helps people suffering from depression. Research shows that CBD oil causes the receptors that release serotonin to fire more effectively. This increases the serotonin production and stabilizes its presence in the body. And so again, when I see someone struggling with depression or insomnia or reduced concentration, again, my go-to is CBD. Now we have anxiety. Again, anxiety is the number one mental disorder that is impacting people right now in particular. And these symptoms can be alleviated, can be really supported with the use of CBD. We have symptoms like excessive worry, difficulty controlling your worry, restlessness, feeling on edge, irritable, muscle tension, difficulty sleeping, or again, sleeping too much, easily fatigued, reduced concentration. All of these symptoms are causing significant distress occurring for at least 6 months, and it could be about multiple events. It doesn't have to be one thing that causes you stress. Like, some of the patients that I see are stressed about wearing the mask when they're at work, or being in close proximity to other people when they're at work. So that's causing anxiety and fear of, getting the COVID. And so again, these are symptoms that meet the diagnosis for anxiety. And if we're seeing this longer than 6 months and it's impacting your ability to function, then my go-to, again, alongside with therapy, because of course that's a comprehensive method in itself, but my initial, recommendation is, have you heard of CBD? Have you tried CBD? Let me tell you a little bit about it and how it can help those symptoms that you're experiencing. Researchers confirm patients' subjective reports of reduction in anxiety after consuming CBD by performing brain scans, showing cerebral blood flow patterns consistent with an anti-anxiety effect. So when people take the CBD, they're reporting a relaxation in a similar effect that those anti-anxiety meds give them. CBD significantly reduces social anxiety by affecting the amygdala and other areas of the limbic system responsible for our behavior and emotional responses. And so again, all of that anxiety that grows, whether you're interacting with people or particularly trying to be cognizant of social distancing, can benefit from CBD because, again, it provides that calmness, that balance, really reduces your stress and allows you to focus. One thing I want to say that I recommend to my patients that are dealing with panic or panic attacks or having any type of avoidance of situations, I go to the vape pen, the CBD, but provided through the vape. Why? Because it's an immediate delivery system to the lungs and it gives them that immediate relief within seconds. Okay, so that's kind of what I want to say about the anxiety, the depression. Um, I'm going to speak a little bit about, if I can, gonna speak a little bit about what we know about CBD. Okay, are you guys seeing my screen still? Let me see, let me open up the chat. Okay, great.
Yes.
Great. Oh, I can hear you. Wonderful. Okay. And so again, we're talking about CBD, right? Let me see if I can get this out of the way. Hold on. Close my chat and bring you all down to the side. Okay. All right. So we're talking about CBD, right? Let me just go back. We are the crown jewel of CBD. Our vision, let's see if I can get this. I always have problems getting this visual of us to move out the way. Our vision is that we exist to help end the negative stigma that has caused communities around the world to suffer and lose out on the health, wealth benefits of the cannabis plant. Our mission here at Wakana is that we are the catalyst to stir a movement that inspires people to confidently move into the legal space as entrepreneurs, formulators, and investors, evoking the courage and strength of people to take back their health, wealth, legacy, and freedom. And so we know that with the passing of the 2018 Farm Bill, uh, the sale of CBD became legal, and it allowed for us to increase the awareness of CBD. It allowed us to increase the research and money going into learning more about the endocannabinoid system. And it really allowed us to have a foot in the game, if you will, in this growing cannabis industry. And so cannabis went from illegal to now essential. And it allows us, our community, our people to really reap the benefits, the financial benefits, the physical benefits, the mental health benefits of this phenomenal cannabis plant. And so we are very excited about the opportunity here at Wakana. Um, Again, the market is basically saying that by 2024, we could be reaching $20 billion in revenue from CBD. So that is major, major game changer. And we're just excited that Wakana offers this opportunity. And right now, again, our company is still very young. And we're, again, this is a little outdated, but if you can see it, we really are projecting millions in revenue from this opportunity. Because of the growing awareness of the value of CBD and the science behind this amazing plant. Okay. And so what is CBD? CBD is short for cannabidiol. It is a compound that naturally occurs in industrial hemp. And out of more than 85 different cannabinoids, it is the second most common next to Delta 8, THC. And unlike THC, CBD is non-psychotropic and produces the health without the high. Wakana products are third-party tested and fully compliant with the State Department of Agriculture, and all of our hemp is grown in accordance with the Farm Bill. And so what we often do here at Wakana, and particularly in my practice with mental health, is have to do some relearning, some unlearning of what people once thought about cannabis. Because when you say cannabis, people automatically think marijuana and THC. But we're talking about cannabis from hemp, where CBD is derived from. And so there's a difference between THC and CBD. THC has psychoactive effects, whereas CBD is non-psychoactive. That means it doesn't give you that high. THC stimulates the receptors in the brain's pleasure center, whereas CBD stimulates receptors in the brain that regulate pain, perception, anxiety, nausea, and more. I like to say CBD, because the receptor sites are more scattered throughout the different organs in our body, give us a full body relaxation and calming effect that helps with the homeostasis. We know that THC releases higher than normal levels of dopamine. And we know that CBD, again, has the anti-inflammatory and pain relief properties. Again, THC gives you the high, CBD gives you the medicinal benefits, but without the high. These are some of the other cannabinoids that are found in the cannabis plant, and these are comparisons as to really the benefits that CBD has over some of the other cannabinoids. And so if you see here CBD right down the middle, where it's mostly black, shows you the benefits. It helps to reduce pain, reduces nausea and vomiting. It has been shown to increase bone growth. It has been shown to help with reducing tumors, the properties of tumor, anti-tumor properties. It might even help improve psoriasis, improve sleep, help reduces seizures, slows bacteria growth, relieves anxiety, benefits our nervous system, benefits arteries, reduces inflammation, has antifungal properties, improves muscle spasms, and might even help with psychosis. So if you see, CBD has far more benefits than THC and some of these other compounds that are found in the cannabis plant. And so this is just a brief review of CBD and the receptors and where they're found in the body. We have receptor sites in the brain, the heart, the teeth, the stomach, the skin, bowels, kidneys, liver, lungs, and eyes. And so again, when you intake the CBD and the receptors are receiving the CBD, it's really a full body calming effect that that I personally really benefit from. These are just some of our products, very minimal products that we have. We have a full line of immune defense. We have a full line of essential oils, including the First Defense nasal spray, black seed oil, um, power hempranium oil, um, tea tree oil, peppermint oil. Again, we have several. Two of our more popular products, let me see if I can pull it up, is our Power Relief, our cream, our Relief Pain Cream. It's a topical cream, and right now the highest I think is 400 milligrams or 500 milligrams, and that's our number one product, that pain topical relief cream. We also have a topical roll-on. We have our Power, that is less than 0.3% THC products, and we also have our Pure products. Let's see if I have a copy of our Pure products. No, I don't think so. Okay, well, our pure products, you can see they're the Pure gummies. We also have the Pure tinctures. Those, we've removed the THC in them. It's 0.0001%, I believe, THC, and so very, very just minimal, 0.0% THC. So that's what I recommend for those who take random drug tests or working in a professional environment where they might be required to take a drug test. We have culinary products, again, infusing with CBD spices. We also have a Delta 8 culinary oil. Those are our essential oils that we have. We also have more of them. And we have a whole full hair care line, Save Our Strands hair care line. And so really, and one of the things that I haven't even mentioned is our flat belly lifestyle. We have a line of gummies, coffee, tea, bitters tea, as well as our 21-day detox that is super popular right now going on. I am currently in my 14th day of the 21-day Flat Belly 2.0 detox program. And I just have to say, I feel great. I am just blessed to have began this 21-day detox. I just want to note our disclaimer that our products are not for use or sale by persons under the age of 18. Our CBD vaping oil, Power Hypnotic and Pure Crypto, we also have a raspberry, are not for use or sale to persons under the age of 21. Our product should be used only as directed on the label. It should not be used if you are pregnant or nursing. Please consult with a physician before use, or if you have a serious medical condition or use prescription medications. A doctor's advice should be sought before using this and any supplemental dietary product. All trademarks and copyrights are property of their respective owners and are not affiliated with, nor do they endorse this product. These statements have not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease. Wakana for Life does not sell or distribute any products that are in violation of the United States Controlled Substances Act. Some of our smokable hemp is banned in Louisiana, North Carolina, Kentucky, Indiana, and as of August 2nd, the state of Texas. I'm not sure if this has changed though, because as you can see, this refers to 2020 and we are now in 2022. I just want to pop back up and then I will take any questions you all have. Just want to kind of go back to my daily prescription, if you will, of self-care. So for me, again, CBD is a daily for me. I think of CBD as like a vegetable. You know, in order for you to get the benefits of it, you have to take it daily. And so some of my daily self-care rituals include prayer, meditation, journaling, affirmations, and really speaking what you want to experience in your life. having gratitude for what you have, and being thankful for what you have and not focused on what you don't have, using movement, any kind of movement, whether it's exercise or dancing or trampolining, which I know they do 8:30 in the morning here at Wakana, music, and again, CBD. So I just want to thank you for allowing me to present on mental health briefly and some of our CBD products, and just hoping you get a better understanding of the difference between CBD and see. I do want to mention our products here at Wakana are third-party tested to remove any toxins, heavy metals, pesticides, and we really offer the purest quality of CBD. They're USDA certified organic, and if you haven't tried them, you have to try them. They're really a game changer. And so with that, I am going to just take a look here to see what questions anyone might have that hopefully I can answer. It has changed for those states. Okay, very good, Cherie. You want to let us know if you want to unmute yourself? I think you can, and let us know if you know what states currently are banning the flower or the vapes for that matter. Are there any questions that you all might have? Okay, let me see. Okay, I see you can only put things in the chat. Okay. Okay, if you put it in the chat, I can let everyone know. Is there anything you want to offer, Dr. Betty?
No, I think you've done a marvelous job. Very thorough.
Okay,
I
thank
even
you.
I even learned a lot. Thank you so much.
Okay, let's see. When experiencing anxiety, if one can't vape, what has been your suggestion? Okay, so if one can't vape, my go-to is the gummy. I usually suggest the vape if a person is having panic attacks because I know it's immediate delivery. But if they're just wanting some relief from the anxiety, then I will recommend, if they like, I'll ask them, do you prefer tincture or do you prefer gummy? And if they say they like the tincture, then I will start with the 500 hempranium, and I will tell them to take 3 drops, anywhere from 1 to 3 drops twice a day. And what I usually suggest is that they start with maybe 1 to 2 drops and kind of give it about 20-30 minutes and see how they feel. And then if they don't really feel the calmness that it brings, then I would suggest that either midday or evening when they try it again, that they bump it up a drop. So they might go to 3 drops or 4 drops. And because everyone is different, and their muscle tone is different, their weight is different, how their body is going to respond is different, I just tell them to start low and then increase by 1 drop. And again, I ask them to pay attention, because sometimes people will take a gummy, and gummies take about 45 minutes to kind of really give you that effect. And so sometimes people won't even pay attention, they won't notice. And so I will say, when you take it, if you're taking the gummy, then around 45 minutes, start noticing how you feel. If you're taking the tincture, wait about 20 minutes, see how you feel, because that will give you a clue as to whether you want to take the whole gummy versus half a gummy. So I always start with half a gummy, and then take the whole gummy if you're not feeling that calmness. If you're using the tincture and you're not feeling that calmness with 3 drops, I say bump it up 4 to 5 drops. Again, because you don't know, everyone is different, but that's my go-to. It's either the gummies or the tinctures. And if they're not getting the effect with either one separately, I will recommend that they combine them, you know, because I know that they're going to get more of an effect with the tincture immediately, and then once that kind of calms, then the gummy will kick in after that. So that's kind of what I recommend. So in Indiana, the ban was lifted. Okay, thank you, Cherie. So she says that you can in Indiana get the smokable hemp. So many children and teens are experiencing anxiety. Where should parents start if they want their children or teens to take CBD? So what I usually do when I'm working with someone, I will talk with the parents about it, because again, I usually have to educate the parents that CBD is not marijuana. It doesn't get them high. There are proven medicinal benefits from it. I might send them some research articles on anxiety, or I might show them some of the screens, some of the slides that we use, so they can really see the difference, and they can understand. Um, and so, okay, she says all of those states were lifted. Thank you. Thank you. You know, my slides are a little outdated. So thank you. So all of those states were lifted as far as the flower CBD. And so once I have the parents understanding, I will start with the pure product, because the pure product is 0.001%, I believe. So I know that, you know, it won't be as strong as the power. And I know that with the pure, it'll be, you know, it'll be beneficial for them. And again, same thing. I will recommend for the pure, I believe the dose, the milligrams is 300 milligram. And I believe we might have one that's 100 milligram. So I will just have them start with the 300 milligram pure. And then again, starting with two to 3 drops, and see how they feel. So I will recommend that they start on the weekend. So they're not in school, and they can kind of, you know, be aware of how it makes them feel. Or if they want a gummy, they can start with the pure gummies, a half a gummy. And then if they don't have an effect from it, or they don't feel the effect, then I will have them again increase by 1 drop. Um, that's what I usually do. Yeah. Anything else? And I have my, I have everyone in my family taking it. I take it. My husband takes it. My son, he's 14. He takes it to help him focus, you know, in school. So I don't have to hear the teacher talking about he's off focus and he's too chatty. My daughter, who went through a stroke during COVID, from COVID. I have her taking it because it's a neuroprotectant, and I want her to be able to, you know, get the stimulation that she needs, and the neuronal growth that she needs for that. Can someone with COPD take it? Now, you know, I am a psychologist. I am not a medical doctor of, you know, that deals with physical conditions. So I would refer you back to, let's say, a Dr. Rita or Dr. Vetty. She might know. I'm not sure about that one. If there's anybody else on the medical advisory board that wants to chime in, please do.
Hi. So,
Hi.
so I don't know of any reason that a person that has COPD would not be able to take CBD except in a smokable form, because
Yes,
they already have compromised respiratory function. So you wouldn't want to compromise it any further.
absolutely.
Yeah.
Absolutely. Yeah.
But other than that, I don't know why.
Right,
And
because it probably
what
will help them, calm them. Because a lot of,
exactly.
I know actually some of my patients have COPD, and it actually increases their anxiety because they're
Right.
afraid of having a coughing fit if they're, you know, outside somewhere, or they're doing too much, they're walking too much, and so that induces the anxiety.
Right.
Um, yeah.
I think the only concern would be what medications they're taking. And so, as we always mention, always consult with your doctor and let them know what it is you're using or planning to use so that they can determine whether there are any drug-to-drug interactions.
Yeah. Are there any other questions related to mental health and CBD that I can help answer? What can be used to aid a person to stop smoking? I mean, I usually recommend the pre-roll, the pre-roll, because usually when people are smoking, they want the calming effect. And you know, there's not all the toxins and chemicals in the tobacco, but it's the CBD flower. So they get the effect of the CBD, but in a smokable form, which is going to be helpful. What do you think, Dr. Betty? You want to say
I
anything
agree
to that?
wholeheartedly. Definitely.
Okay. It says Barbara has a question. She's raised her hand. Barbara, you wanna come on in and say what you want to say? For hot flashes. Well, I can only, again, I'm a psychologist, so I can only speak on what my patients that I've been treating that have hot flashes. So they tell me the 500 milligram hempranium works for them for hot flashes. Again, depends on their dose, is an individual thing. They might be doing 5 drops twice a day, 6 drops. I'm not really sure, but they tell me that it does help with premenopausal, postmenopausal, during menopause, those hot flashes. Um, what do you think, Dr. Betty?
Well, that is definitely true. Again, we have to remember that CBD balances the systems of the body. That means the endocrine system, which affects the hormones. So there you go.
Yeah.
And just like any other issue that one would take CBD for, the individual person's assimilation, their body weight, and all of that would need to be taken into account. So just as always, we start with 3 drops twice a day and work from there.
Yeah. Yeah. Yeah, that's one thing I say. Yes, the 500 hemp has helped my hot flashes and slow down on sugar and coffee. All right,
Right.
Cherie, thank you. Well, there you go. There's a testimony. I mean, I always, when I'm explaining it, I always tell them, our endocannabinoid system is responsible for homeostasis and balance in
Right.
our weight, in our sleep, in our emotions, right? Uh, in our chemicals, neurotransmitters. It really, the endocannabinoid system is such an amazing system, and so it's just the beginning. And that's why I think CBD is such an amazing plant, you know. Cannabis is such an amazing plant because there are so many benefits to it. And we're really just beginning
Just
to learn
beginning.
about this. And so I'm excited. I'm excited about where this is going to go. And that's why, we always say at Wakana, it's a movement, because we are all thriving to be healthier physically, mentally, emotionally, spiritually. And it's a game changer, you know. Are there any other questions or anything that anybody wants to say before we end? Can it help with bipolar? I do have some patients who are bipolar, because remember, we just talked about the stabilization of mood, you know. So for my patients, again, A lot of my patients that have bipolar are taking psychotropic medication to help stabilize their mood, but it can't help. And so I will tell them, if you want to give CBD a try, just make sure you do it maybe like 3 to 4 hours after you take your psychotropic medicine, so that you won't have any interactions. But yeah, they've told me that it has helped because it calms you and it focuses you, and I think that's where the emotional imbalance uh, you know can be benefited. Mhm. But again, always consult with your professional. And so with bipolar, if you're taking a medication for it, consult with a psychiatrist. Anything else? The hempranium. Yep. I always start with the 500 milligram hempranium. That's just my go-to because I know it works. It works for me, and so that's what I recommend. Or I'll start with a half a gummy, power gummy, unless I know, and I'll ask them, are you taking drug tests? Are you working in a professional environment where you might be tested? So, yeah, but those are my go-tos, the 500 hempranium and the power gummy. What about you, Dr. Betty?
Am I muted? Yes, I tend to gravitate towards the hempranium as well as I love the gummies,
Yep,
the
look,
power gummies.
look,
Yes.
there go the hempranium right there. Before we went on, right?
Yes.
500 milligram.
And I like to vape if I'm feeling anxious. That just really sets me in balance and calms me down so that I can do whatever it is I need to do.
Yeah, because it's immediate. That's what I like about the vape.
Yes.
And I tell them, it doesn't have all the toxins. It's a pure oil that
Right.
is just vaporized,
Right.
from the heat of the battery. That's it. Because a lot of people were afraid of the vaping after the whole
Right.
tobacco thing. But I just remind them, we're not talking about tobacco here. We're talking about a CBD oil um, that is pure, and it's just a
Exactly.
delivery system. It's just a delivery system to get it to you, you know, within seconds, so that you can be calm, yeah, and focused, and handle your business. Yep. All righty. If there are no questions and there's nothing else, Dr. Betty, you want to say, then we can end for our doctor's
No,
edition
I
tonight.
no, I think this was awesome. You did a great job. Thank you so much.
Thank you. Thank you.
Somebody's got their hand up.
Okay, okay. Let's see. Is that mine? Look, is that mine? I think that's my
Hey, can
hand.
we go now?
Trying to work out this. Okay, so what's your advice on using CBD and working in a professional setting? I work in a professional setting. Look, I do, for a minute I was in person in the doc because I'm one of the medical consultants for Social Security Disability, right? And I was in a professional setting, and I use it every day. I feel like when you're in an environment that is high paced, high stressed, high demand, to me, you need CBD. Yeah,
Exactly.
absolutely. When I'm working with people and I'm trying to, provide emotional support, not trying, providing emotional
Mm-hmm.
support,
Mm-hmm.
providing guidance and direction. I
Yes,
need to be calm and
that's
focused.
right.
I need to have my head on straight. And so I couldn't do it without CBD. I'm just going to keep it real. You know, I work as a child protection investigator, and I tend to take work home with me. Extremely stressful. Okay, love, you need some CBD.
For sure.
You need some CBD. You just got to decide how you want to take it. Do you want a gummy? Do you want an oil? Do you want to
You
vape
want
it?
to
Do
vape?
you want to smoke it? Do you want to gather it and lotion it up on you? You know what I mean? As a secondary, you know. You want to put it in your cooking, you just got to decide. And so again, if you're doing random drug tests, then I would go with the pure. If not, go with the power. Yeah. And boy, that's a stressful job. I know. Okay. Okay. So if there are no other questions, all right. And if you all have any questions or y'all want to learn more about what I do, go to my website, healthyminds.expert, healthyminds.expert. You can listen to my podcast. You can read the articles that I've written in Fet Lifestyle magazine and learn more about me. Okay. All right, everyone. Well, have a pleasant evening and God bless. Y'all stay safe and take your CBD. All right. Okay. Thank you so much, Dr. Betty. I appreciate you being here with me. Okay.
Thanks for including me.
Yep. All right, you all. Have a good night.
Good night.
Okay.